Tetanus prophylaxis after injury. This is the schedule of tetanus vaccination: primary series, then booster series, and DTaP or TD is the name of the vaccine. There are 4 doses in primary series: dose 1 at 2 months of age, dose 2 at 4 months of age, dose 3 at 6 months of age, dose 4 at 15 to 18 months of age. There are 2 doses in booster series and then subsequent doses. First dose in booster series 4 to 6 years of age, second dose in booster series 11 to 12 years of age, then subsequent doses every 10 years. Tetanus prophylaxis after injury. Management is based on tetanus vaccine history, wound assessment, immune status, for example, immunocompromised state, HIV infection. Tetanus prone wounds include dirty wounds. Dirty wound is a wound that contains foreign and/or potentially contaminated material. Foreign materials include solid bodies, for example, bullets, retained suture. Potentially contaminated materials include saliva, including human or animal bites, urine, feces, and other bodily fluids. Deep injuries, deep injuries or avulsion injuries, crush injuries, and puncture wounds. Thermal injuries. Thermal injury is a localized injury, for example, burn, frostbite, caused by exposure to extreme hot, for example, fire, or liquid or cold temperatures, for example, freezing conditions. Post-exposure tetanus prophylaxis. If tetanus vaccine history is unknown, or there are less than 3 doses, and wound is clean and minor, administer tetanus vaccine. If tetanus vaccine history is unknown, or there are less than 3 doses, and wound is tetanus prone, administer both tetanus vaccine and human tetanus immunoglobulin in separate sites intramuscularly. The dose of human tetanus immunoglobulin is 250 international units intramuscular once. If tetanus vaccine history shows more than 3 vaccine doses and wound is clean and minor, and then if last tetanus vaccine is less than 10 years ago, no action required. If last tetanus vaccine is more than 10 years ago, administer tetanus vaccine. If tetanus vaccine history shows more than 3 tetanus vaccine doses and wound is tetanus prone, then if last tetanus vaccine is less than 5 years ago, no action required. If last tetanus vaccine is more than 5 years ago, administer tetanus vaccine. In patients who are severely immunocompromised, administer human tetanus immunoglobulin 250 international units intramuscular once. For children less than 7 years, an acceptable alternative dose for prophylaxis can be calculated by weight, that is 4 units per kg. It is often recommended that part of the intramuscular injection should infiltrate the wound, however, supporting evidence is lacking. Administer human tetanus immunoglobulin to patients with severe immunodeficiency or HIV infection and a tetanus-prone wound, regardless of tetanus vaccine history. Thank you.